Hello and welcome to episode 63 of the Dental Realist Podcast. I am one of your hosts, Ryder Waldron, and I am here with Dr. Troy Stevens and Dr. Marcus D. Neff. Troy, how's it going tonight?
Going very well. I really appreciate you guys accommodating me and doing a little 30-minute earlier podcast time than we actually had scheduled. So, man, you guys are you're great.
We got to get you to bed, so
yeah,
we're
well,
happy
that's
to
the problem,
do this
I know. Podcast 63, and that's about our age now, you know.
Well, speak for yourself.
Well, my age, yes.
Marcus, are you still with us? Are you still awake? You're alive and kicking, you said?
Yes, I'm alive and kicking. I'm still awake. I'm primed and ready to go. I'm excited to talk tonight.
Yeah. Good.
Marcus
I can feel your
sad
enthusiasm.
that he had to go home after the office today. You know, he just didn't want to go home. He wanted to keep going.
Yeah, Marcus does that.
Keep on working.
That's right. The dental day is done too soon.
When I ask my patients, how was your weekend? They say, "Oh, too short." Marcus says it wasn't short enough. He's got to get back
That's
to
right.
dentistry.
Yeah.
I'd work 8 days a week if they'd let me.
You bet you could. Well, tonight we have a topic that Marcus came up with. We're going to be talking about a blog that was on the New Dentist blog, or an article, I guess it was on the New Dentist blog by Dr. Let me get the name right, Muhalab Al Sammarraie, and it is called "The Pursuit of Excellence: Overcoming Perfectionism in Dentistry." So I'm assuming we all had a chance to read this. Troy, what were your initial thoughts on this?
I thought he was pretty spot on with stuff. Dentistry is very, very prone to us critiquing and criticizing ourselves because of sometimes things aren't absolutely perfect, which, like, he mentioned here that you can't be perfect. It's impossible. So yeah, I thought it was a pretty good article, good stuff to discuss tonight. Dentistry is notoriously bad for this, I think, because of, we don't accept failure in any way, shape, or form. And we have very, 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 very small margins and small things that we work on. And so, yeah, it's rough.
And pretty much everything we put in the mouth is destined to fail at some point, except maybe an extraction. And I could probably even pull off a failed extraction. So,
and then when it fails, you blame yourself.
That's right. Yeah, right.
You might as well just put the blame on you.
You could extract a tooth and the person go smoke, a 12-pack of Marlboro Reds, and you still blame yourself for the dry socket they got. So, yeah. Yep. Marcus, what captured you about this article that made you think it was a good idea to talk about it tonight?
Well, I just remember back to dental school feeling like even back then, like this intense like pressure to be perfect. It's kind of just slammed into you from the time you get into dental school and you get going, that you've got to have just like pristine margins. Everything's graded pretty strictly in your labs and all these different places, and they don't very often. I don't remember them talking very often about clinical acceptability. It was more just like, well, that margin's not perfectly smooth on that crown, or that prep you just did has just too much taper, or so just trying to constantly reach this perfect, almost like impossible standard of everything you do in dentistry, and at least in dental school, that's where it started for me.
Yeah, when I was going through this and making notes and stuff, that was one thing I wrote down, is that I wish we had known this in dental school, and I wish we had gotten some real world perspective that everything doesn't have to be perfect. Like, yeah, you talked about crown margins and things like that. You can make a pretty rough crown margin, or pretty bad looking crown margin. You can have like 25 degrees of taper, and you can still get a crown to work and stay on. So I don't know, like, what advice, since we're talking about dental school, Troy, right now, what advice would you give like dental students right now as far as this whole perfectionism thing?
Yeah, that's a great question. the problem that I think that we have, especially as dental students, is that the faculty doesn't really allow you any margin of error. They grill it into you that everything has to be perfect. Like, do you remember when we used to wax up those teeth?
Yes.
And we used, and sister as a list class, we had to like wax up different colored cusps of different occlusion. And then we would wax up an entire crown, and it would take you days to do it, and they would just tell you to redo it because it sucked. So it's really challenging in the dental school environment, I think, to get past it, because I mean, how else do you get through it without redoing stuff when they tell you to? Like you said earlier, though, I have seen crown margins that look like total crap that have lasted for 25 years, right. So, and you see stuff that looks really good that doesn't last that long. So it's a crapshoot. How's that for a good answer?
No, I think that's probably true. So another question I had, Marcus, with this whole perfectionism thing. Well, first of all, I found this, it's like in Psychology Today, and it talked about perfectionism, and it said perfectionism is the fear to fail. It's not necessarily doing good things. It's just the fear to fail. How do you think perfectionism could lead to burnout? Because burnout is a big topic in dentistry right now, and I think we've all felt that at some point in our careers.
I think it can lead to burnout because it's impossible. Like, it's impossible to do perfect dentistry. I mean, it's impossible to do virtually anything perfectly. And that's why I liked the article is just the change in that phrase from perfect to excellence. Because if you're constantly saying, I got to get this perfect, I got to get this perfect, I got to get this perfect, you're always failing. And if you're always failing to reach perfection, I mean, you're going to just inevitably feel like this is pointless. I hate this. I can't stand this. Everything fails eventually. It's not perfect. And it's just this unrealistic expectation. I think it definitely can play a part in burnout and getting just sick and tired of the profession.
Yeah. The excellent thing, like, I think, well, I guess perfection and excellence are both like probably subjective terms, but excellent, like Troy was saying, you might have a crown that lasts 25 years. I'd say that's pretty excellent. But in some situations, if you got a crown to last 2 years, that might be excellent also. Neither one of them are perfect because they didn't last forever, if that's what perfection is. But, there's some composites I'll put in, and it might be in like a puddle of saliva or blood or whatever. And afterwards, the patient doesn't have any pain and it lasts several years. I'd say that's pretty, that's excellent. And it's also just a crapshoot. Like Troy said, it's just probably a luck of the draw. But isn't
it funny how, I'm sorry, I cut you off.
No, go ahead. No.
So I was like, isn't it funny how we expect perfectionism in all of our work in a very, very, very imperfect environment? The mouth is such a hostile place. I mean, the temperature fluctuations, the people bruxing, clenching, grinding, the microbes that live in the mouth that are constantly trying to destroy everything we put in there. It's insane that we think that we are going to be able to have everything work perfectly all the time. Ever get perfect. But yet that's kind of what's grilled in our head in school, is that everything has to be perfect. Margins have to be perfect. Contours have to be perfect. Everything has to be perfect. Oh, but yet, when Sister Jones takes that crown home and she doesn't brush and floss it for the next 20 years and it fails, that's our fault.
It is amazing.
Yeah, we didn't do perfect enough. You're right.
No, I got decay underneath my crown, so that's somehow the dentist's fault. Yeah. Just today I had a guy that he has just cavities everywhere, and in the last month he's had 2 root canals, a crown, 2 fillings, and then he broke another tooth that we had diagnosed one on, but his insurance is maxed out, so he doesn't think he can, do anything to fix that right now. It's like, well, how's that my fault? We just do a bunch of free work or something like that. I don't know. It's like, I want to tell people it's not that expensive to brush your teeth. but
No.
you can't even perfectly brush your teeth, which is something we've been doing since we've been like 2 years old. And you expect me to go in there and fix it perfectly when you can't even maintain a clean, I don't know. Yeah. Well, now I'm getting all fired up, guys.
No, I know. It's irritating, isn't it? And you're right, though. The answer is just like a $2 toothbrush.
Yeah, like it's
and
amazing.
Use the brushy side, right? Make sure you use the bristles. If you're hitting your teeth with the plastic, you're probably not using it right.
Yeah, it's probably the wrong side. So another thing that is big in our lives now is social media. So Troy, how do you think social media contributes to, especially just specifically dentistry, to our perfectionism in dentistry?
Well, I'm not sure exactly, other than maybe like if you're thinking like reviews and things like that, I think that we are so paranoid, at least I am, of getting someone saying something, it didn't last, or, we charged you, heaven forbid, for a service we provided. You know what I'm saying? Stuff like that.
Yes.
And then that stuff is just absolutely gone. That just goes crazy on the internet because, the internet's always right. And there's never a dentist behind the story that can actually tell their story because, we're all under violation of HIPAA if we start blabbing our mouths on stuff. But so we can't defend ourselves. So it's very stressful that way, as far as that goes too, because, another thing is you feel like if you aren't doing perfect work, somebody's going to go blab about it, and then, you're going to get a bad rap.
Yeah, I'm thinking about on a different angle on that is things like Dental Town, which I think is a great format that's been out there for a long time. And you can go on there and read about other dentist things that they're doing and successes they've had. But just like, Facebook or somewhere else, a lot of times you're going to read things on there that or see things on there that are somebody's, best moment. And even if somebody posts something that isn't their best moment, sometimes you can read all these different opinions about what should have happened and how it should have happened and think, oh my gosh, I didn't know that, or I don't do that, or you can just get into this comparison game and think, holy cow, I there's no way I'm perfect. There's no way I could do this. So I think it can be a little bit challenging on social media. Even Facebook, there's dental groups on there. Some of them are better than others that you can go on and post questions and things. But it's easy to start comparing yourself to everybody else and think that the things that people are saying and posting are real. Sometimes they are, sometimes they aren't.
Yeah, I mean, I see stuff all the time, like these amazing cosmetic cases or this amazing root canal this guy did, and he's just a general dentist, and this stuff, and I just think, well, gosh, maybe I'm not that good of a dentist, but they're also not posting their failed cases or anything like that. They're, you see how happy their office is all the time, and it's just like, people posting pictures of their families. They don't post the bad stuff; they just post the happy times, and so it's hard to not see that and see, well, this dentist used this product. Oh my gosh, I probably need to buy that right now. That'll make me a better dentist, when that's not even close to true. This Dr. Al Sammarraie said, loving your work and being proud of what you do is natural. But sometimes for me, guys, I don't know about you, it's hard for me to be proud of my work. Even when something goes really well, I don't like to get too high on my horse about it because I feel like there's always another shoe to drop in dentistry to knock me down and make me humble again.
It feels that way, right?
All the time. I mean, like, even like if it's a root canal, like that thing went awesome. And then it's like 4 months later, that tooth's hurting him again. Ah, crap. Yeah. I don't know. I feel like I just don't have the confidence or whatever to get proud of my dentistry. Sometimes it's just so humbling.
Yeah.
Mm-hmm. Yeah. It's come to a point where, we've been doing this for 21 years now. I just do the best that I can given the situation, like I say, some people can't open their mouths. They got saliva everywhere. Their tongues are everywhere. Their cheeks are everywhere. You've always, the person who can't swallow their own saliva or whatever it is, you know what I'm saying? It's like so incredibly crazy that they can even survive. And you just do the best you can given the situation because like you said, Ryder, sometimes, if you get a little moisture in there, you just cross your fingers and pray that the thing works, that it lasts. You did the best you could, you isolate it the best you can. You sit and wrestle that tongue the best you can, I mean, it's crazy, man. The environment we work in is crazy. People that can't lean back because, heaven forbid you lean back and have to be able to see what's going on when you're working.
Yeah, it's amazing that, I can't get tipped back or I'm going to pass out. Really? I like with some of those people, I almost want to test that. Like, let's see if we get you to pass out. It'd be easier to work on you.
I wonder what would happen, and I've never done this because, of course, I'm just too dang nice. If you just say, well, I can't work on you.
Right, yeah.
I mean, sorry, I can't see.
I
cannot see.
Yeah.
Do you want me to be able to see?
It's true.
I've never said that to anybody. I probably should.
I've said that, maybe not in those words, but I've never said I can't work on you, but I have said, well, I need to tip you back so I can see your tooth. If they want you to fix like number 15, how are you going to see that if they can't tip back? I just don't understand that.
Oh, it's happened. I just did one the other week.
Yeah,
lady couldn't lean back because she's had back surgery and a fused spine and all this stuff. And on number 15, she's got a massive cheek and I mean, just, can't open. Very, very nervous. I mean, it was just a great scenario all around. So guess what? I've got to make sure that everything's perfect, right?
Yeah. And you've got to make that last.
Yeah, it has to. I mean, they're paying $1,000.
Yeah. One of my favorite things to do in dentistry, which I don't know if I have a favorite, is when you have like some bombed out tooth and you tell them, they need to have a crown or something like that. And they say, well, just patch it up. The best feeling is when you can patch that tooth up and it doesn't have to last because you've already told them they need a crown and it could either last a long time and you win and you're an amazing dentist, or it could break and you were right and then they need the crown. I don't know, those are the like less pressure packed situations for me, I guess.
Mm-hmm. Yeah, when you're able to set the expectation kind of and just set up the scenario for them and either way you come out on top.
At least on top somehow. Yeah.
It is great when a patient takes responsibility for their own actions, and doesn't put the blame somewhere else, which, there are people that are like that. They definitely, hey, I haven't taken care of my mouth. That filling you did, 5 years ago, it's broken, whatever, and they go, yeah, I didn't do what I needed to do. It's like, wow, that is just so refreshing to hear. Because I really think that the vast majority of people nowadays are like, oh my gosh, it's your fault for everything. Oh, and you charged me full price for this. You
charged me. Yeah.
Heaven forbid.
Yeah, I had just that situation today. So this lady had on number 4 a big MOD amalgam, and like in December she broke off the lingual cusp. At that point I said, you need to have a crown on this tooth. Oh, can you just put some filling in there and patch it up? Okay, just so you know, it's probably not going to last. Well, she came back today. She ate some caramel, and that filling came out. So I said, well, you really need to have a crown on that tooth. Well, why don't you just put a filling in there, and I'll just be careful on it. Okay. Well, now, and she knew it was the same tooth that she had fixed. And I'm thinking, you're going to pay as much for this filling because your insurance isn't going to cover any of it as you would have if you just did a crown on that. And I don't understand that mental block that some people have. Maybe I'm just a bad salesman.
No, there are people that are like that. There's no doubt about it.
Yeah.
So this perfection thing, I also think kind of ties into the suicide rate in dentistry. And we all know that's very high. We are super overachievers when it comes to suicide rate. And, if there's one thing we're perfect at, it's hiding our stress. But before dental school, I knew the suicide rate was high. But did you guys ever ask any dentist why the suicide rate was high?
Nope.
I don't think I did.
Yeah,
I never did.
I figured it was because of amalgam.
That's right. It's toxic.
The root of all our problems.
Responsible for everything.
It really is.
Yeah, and I never did either. I just thought, well, that can't be true at all because look how happy, we've talked about this. Look how happy these dentists are when we go in their office. They're all super happy. Their staff is happy. Their patients are happy. About, I don't know, it was 6 months or so, a year ago maybe, that I had 3 people within about a week ask me, they somehow found out, I don't know if it was something on the news or online or something about the high rate of suicide in dentistry. And they said, well, how come? I mean, these are all patients. A couple of them are friends outside of the office, but they said, well, why is the suicide rate so high? Because can you tell me like what is so stressful about dentistry? And I about wanted to wring their necks because, but I had to explain about this perfection and how everybody expects perfection, and they expect perfection, and they expect not to pay for, as much as we should legitimately charge. So I don't know if you guys ever had anybody ask you after dental school why the suicide rate's so high in dentistry.
I've had people joke around kind of about it, sadly. I mean, it's not something to joke around about. But asked, it's like, I've heard dentists, are high suicide or whatever, and all that stuff. But yeah, I mean, it's true. I think you're right, Ryder. I think the problem with dentistry is we hide it pretty well. You could sit there and be churning around inside, and you have to just sit and smile and grin and make everybody happy, and your staff has to be happy, your patients have to be happy, and your family life has to be happy, and everything. And you're right, when we go to a dental office, before dental school, when you're doing your your job shadowing or whatever, you ever have a dentist say, no, this is a really tough this. No one ever told us that. They never said, oh, this is really, really hard stuff, man, this is really challenging. Yeah. It's like everybody was just like, oh man, this is the greatest thing ever, and it's like, I mean, there are good things about it, don't get me wrong, but man, it would sure been nice to know how stressful it was. And like you say, how everybody expects everything to be perfect, last forever, and not cost a dime. So I think that definitely has a problem that stem from that, why people are, so stressed out and maybe having some issues, psychologically.
Yeah, totally agree. I wish we had been told beforehand, and I think I probably still would have gone to dental school even if they had told me that, and maybe I wouldn't have believed them, but I would have liked to have known, and then at least we wouldn't realize, or at least think that everything had to be perfect. Like Marcus said from the start, or at the start of this, that they always expect perfection in these like fillings preps or crown preps. And it would have been nice maybe just to have like a pass fail, like, yeah, that crown prep will work, or that won't. And I think the majority of them would probably work. I don't know, but I can remember spending, I don't know if you guys remember in the denture lab, we had to use that rubber base material to do a denture impression on those like mannequins. And I think I was about the last one to get an approved impression because I kept getting a couple of bubbles on like up in the vestibule or something. And nowadays, I'd be like, oh, yeah, if there's a little bubble, fine. Well, the lab can work with that. But at that point, we were taught that it was ingrained, like, no, it has to be perfect. You have to make a perfect alginate impression or it's not going to work. Yeah.
At the point where you have the very least amount of experience, too,
Yeah, that's true.
We have to do our best work when we have the least amount of experience.
Yeah, that's a good point. Yeah. And now we just let our assistants do it. They're better at it than we are.
Hey, assistants can take fantastic impressions.
Yeah. My assistant took one today, and she says, "That look okay?" I'm like, yeah, that looks great. Are you sure? Now, what about this? I'm like, no, that looks great.
Wow, don't you get into the perfectionism thing too?
Yeah, let's move on.
So why don't you just settle down right now? You don't need two perfectionists in here.
In this article, it says the curated perfection seen online can lead to unrealistic expectations and feelings of inadequacy, contributing to stress, imposter syndrome, and burnout. Marcus, have you ever experienced imposter syndrome?
Oh, very, very much so.
Good, because I have too.
And it's so weird. Like, I can objectively look at somebody else. I can look at you. I can look at Troy, somebody else, and just say, well, I know you're not perfect, but man, you're a really good dentist. You can do this, this, and this. You're a qualified, competent dentist. But then I can look at myself and any little bit of, I don't know how to do something, any little bit of faking it, boy, I've felt like, my gosh, I am the biggest imposter. I don't know what I'm doing. It can creep in on you pretty fast.
Yeah.
For sure.
Yeah, I had a lady in my office a couple of weeks ago, and she had, I think it was like lichen planus or something like that. And I was going to prescribe her something, and she's like, "Well, does that cause lichen planus to like get worse. I'm like, and I started questioning because she'd probably read something online. I'm thinking, no, this is what you give for that. So I had to go research it for a few minutes to make sure I was even doing my job right and prescribing the right thing when I knew I was. And she had me second guessing because she'd read something online. I just
you feel like an
I
imposter.
don't know. Yeah,
You
feel
can
like a
use
fake.
anything
Like
off YouTube.
yeah, yeah. Well,
Well, with
Troy,
AI nowadays too, you can Google anything, man. You can get
well, that's
answers to
true.
everything.
That's true. And I did see something online the other day that said, when your doctor, talking about your physician, when your physician leaves the room and then says, they need a few minutes to do something, they're actually going to Google to find out, to put in your symptoms to see what disease you have. And I thought, yeah, we'll probably get to that point.
Yeah, they got
that's
their
not too
browser
far.
up to webmd.com.
Yeah.
That's
Yeah.
like, check which symptoms this patient has. We'll tell you what they
Yeah.
have.
Do they need a root canal? I don't know.
Yeah, right?
Well, Troy and Marcus, Story, let's start with you. Do you have any advice that you would give to, any dentist of any age to help remedy this perfectionism problem? Things they can do to help kind of avoid it, prevent it, get over it, get past it?
That's challenging because I find myself still involved in it even now. It comes in waves. Sometimes I'm like, okay, I did the best I could, and I'm able to just let it go. But there are times that I really, really feel stressed about it and go, holy smokes, that wasn't my best work or whatever. So I guess the only thing I could say is to just try and take a deep breath and realize that I don't think there is a perfect dentist out there. And if someone's saying that they never had any failures or never did anything wrong or, anything like that, they're lying to you. That's one thing, I wish that people would just be forthcoming and just say, hey, everybody has stuff that fails. We try not to. Nobody wants failure. Nobody tries to seek it out. But like we said earlier, the environment that we work in makes it impossible for things to last forever. So we have to kind of try and be kinder to ourselves. But we're ever since when we start dental school, they grind it into your head, and since almost day one, and so it's a really tricky thing. It's hard to get out of that mindset.
Yep.
Yeah, Marcus.
Maybe one thing that and again, I'm still not really good at this, but try to set the expectation for the patient up front. A lot of us as dentists, we want to be pleasers. We want people to be happy with us. We want them to like us. And so maybe we don't paint the picture as stark as we really could when we're doing something. Hey, this tooth is pretty compromised already. We're gonna do the best we can. This tooth may hurt afterwards. I'll be surprised if this doesn't need a root canal at some point.
Yes.
Just trying to just really, and I'm not saying just paint the worst picture possible, but just really set the stage that what I'm doing for you is temporary. And I like one of the words that he used in the article, saying revision. This may need a revision
Ooh,
in
I
the
like that.
future.
I like that.
That's something that a lot of times they'll say in the medical field when they replace a knee or something like that. They just up front say this may need a revision. So they're just setting the stage that when it's not perfect, you're not upset that it's not perfect.
Yeah, that's a good one. So one thing that I always, I can't remember which one of you said something about people pleasing. It might have been Troy, but one thing I have a hard time with is that when somebody comes in with something, a broken tooth or a toothache, I always feel the pressure to do some kind of treatment. And it has to be, like you said, perfect treatment. But I guess one piece of advice would be to be able to decline treatment, or if a tooth is beyond saving, just have them get it extracted. And you don't have to do it that day. You can send them to the oral surgeon, but sometimes you might have to disappoint a patient. But it feels pretty good when, I don't know if it feels good, but at least you can sleep at night. If a patient comes in and you see a tooth that you think you can't save, you tell them to go get an extraction. Okay, now you've done what you can, rather than putting in some big filling, hoping it's going to hold or make the tooth feel better, and then just, you get a call from the patient 2 days later and it's still killing them. it, if you had already told them to go get it out, then you would have been covered. So I guess that's one thing, is to not be such people pleasers all the time, because I think we as dentists are that too. We're trying to be perfect in our treatment, everything.
Well, that's another, nature of the wonderful work we do, is the fact that, we have to please people to get them to return, right?
Yeah.
There's no way, if you only saw a person one time and they departed, you never saw them again, you can't have a successful practice like that.
True.
We really have to have people coming back and referring their friends, and that really is stressful, because seems like you're walking on thin ice all the time.
Yeah.
Like a physician, I don't think physicians feel that. I don't think they could care less if someone comes back, because there's just so many people with so many problems, and I don't feel like our medical colleagues are as stressed as we are. I really don't. I don't know. Maybe
at least not for that reason. Yeah. And most of them are employees of an HMO or a hospital or something like that. So they don't have to try to build a practice because they have just patients coming in all the time. Before we stop, I want to cover one more thing and see if this is something that bothers you guys. But one thing is, if I do some kind of a filling or a restoration and it fails, and I thought, that's probably going to fail, I'm okay with that sometimes because I knew it would. But do you guys ever worry what your staff thinks? Like, oh man, he put that filling in. He put a couple of fillings in last week and they both came out. Do you guys ever worry about that stuff? Because that contributes to my perfectionism, is I want my staff to think I'm like the best dentist ever also.
Yeah.
Absolutely. The good thing is my fillings don't fall out, and they do not.
Oh, there we go.
See what I'm saying?
Yes.
You guys see what I did there? No, I'm always like that. When you get like your annual X-rays and stuff, you're like, you look at a margin of a restoration, you go, that's not the greatest.
Well,
and you go, let's go ahead and redo that one. I do think of that all the time. What is that hygienist thinking right now?
Yeah.
Are they going to let me put a filling in them someday or no?
Right.
Yeah. No,
I would recommend they don't.
Yeah, I think of that all the time.
Yeah.
All right, should we wrap up, guys? Anyone have any parting thoughts?
No, we've departed with all the wisdom we have.
We're beat.
We tried
to do a perfect podcast, and we clearly can't do that.
No.
Well, Marcus, do you want to tell everybody where they can find us on social media when they're scrolling through perfect crown preps and root canals and all that?
Right. You can find us, Dental Realist. We're on all the socials. You can also send us an email, dentalrealist@gmail.com. Any questions, comments, we'd love to hear from you. We also have a couple of books out there. You can look those up and get those. They're in digital format. So you want to be a dentist, and so now you're a dentist. Excellent reads, guaranteed to put you to sleep.
Yes. And once you read those, you'll realize that we're not perfect at all. So you can sleep better at night knowing that you're a better dentist than we are.
Right.
Okay. Well, good episode, guys.
Yes. Great stuff.
Yeah, it's fun talking. So we appreciate everyone listening. This has been episode 63 of the Dental Realist Podcast, and we'll talk to you next time. Thanks.